Good morning, and it is the 13th of September, and I thought I'd just do another video for the YouTube channel today. I'm Martin, and I'm the leader of the Sustainable Global Public Health YouTube channel and module at the University of West of England. And if you like our videos, please hit subscribe and, of course, like the video, and you can, of course, leave comments. So today I'm going to be talking about an article that I was forwarded by somebody that I have worked with, and it's not their article, but they found it, and it's a article that was published back in April of this year. So it's really up to date, and it talks about nature relatedness being positively associated with dietary intake and diversity in an urban population. So this study, it was a cross-sectional study. For those that don't know what a cross-sectional study is, it's where you collect data at a single point in time and you observe the variables within that rather than trying to influence them. So you accept that there's going to be variability in your data, and that's quite important to have a look at trends, and particularly if you're looking at nature relatedness, and you're hypothesizing that there's going to be some sort of positive relationship with food in this instance. So this took place in Philadelphia. Philadelphia is a large urban centre in the northeast of the USA, and they looked at adults over the age of 18 who resided within the Philadelphia urban area. They looked at 317 individuals, not a massive sample, but certainly enough to probably look at trends and look at variability. And they used a scale which was developed and validated, called the Nature Relatedness Scale, to measure participants' connection to nature. And this included 21 items across 3 different scales of looking at yourself, looking at experiences, and looking at your perspective. They also looked at dietary diversity, and they used what's called a FAO standard tool to be able to look at actually how diverse people's diet was. And to calculate diversity, they looked at food groups that reported that were aggregated into 9 different categories. So things like starchy foods, green leafy vegetables, vitamin A rich foods, organic meat, meat, fish, pulses, seeds, nuts, milk products, all of those sort of things. I'm reading off my screen here just to get the summary, made some notes. So they looked at daily fruit intake and all of that sort of stuff. And they also asked some questions about socio-demographic detail. And I think that's really important when we're looking at this. And the results showed that people with a higher nature relatedness total, both from self perspective and experience, were more likely to report greater dietary diversity. And I think that's really important when we're considering actually how we might potentially tackle some of the issues that exist around sort of complexities around diet, maybe obesity, and all of those sort of things as a public health challenge. So interesting reading, really. Associations were there, so it's associated, not attributable, as it were. But they basically concluded from this that the better dietary intake that you had, you're more likely to have a higher nature relatedness score, but you're also likely to have socio-demographic connectors, which basically mean that you're more likely to do that. What does this mean? Well, it highlights the need for health promotion interventions that enhance nature relatedness. That's interesting, okay, because it's a solution, perhaps, maybe, because we know that nature relatedness also feeds in to actually better environmental stewardship. So, it is a sustainable healthcare kind of delivery mechanism. And the findings also highlight that we need to probably think about greater levels of social prescribing, green prescribing mechanisms, and trying to kind of create an immersive green space in urban environments, both in terms of what we're doing as healthcare professionals, but also what we're doing outside of this domain. I think this is really important because actually what it allows us to do is kind of think beyond the paradigm of, okay, I'm working with an individual around healthy eating, and it's more about healthy living. Thinking that actually healthy living is a subsidiary to healthy eating. And I think this is exciting for holistic practice, and it's exciting for us to become more green in the way that we do things. And I think that's really important going forward about how we actually engage with individuals over this. Exciting times. For those that want to read that article, it is called Nature relatedness is positively associated with dietary diversity and fruit and vegetable intake in an urban population, and it was published by Milleron et al., and it was in the American Journal of Health Promotion. So peer-reviewed journal as well, back in April 22. So you should be able to find that if you're on the module. I will put it on the reading list, of course I will. But of course, if you're dipping in and you're outside of the module content, then please do go away and read this. If you like this video and you want to see more, please click like, leave your comments below, and of course subscribe, and good day to you all.